We were remarking earlier on the city council members from other towns, and I'm told that ours now has one in the room as well. Is Holly Edwards? Thank you very much for coming. So we just heard from, and here are our other speakers who should join us up here on the stage. Thanks for coming. We just heard from a doctor who has been pushing for this kind of reform for 30 years. And we are now going to hear from someone who is studying to enter the field, who is also pushing for the same reform. So this has appeal across the profession, apparently. Lynn Hassman is a member of the American Medical Students Association here at the University of Virginia. She is a student in medical scientist training, and she also audits classes in public health and offers a different perspective. Lynn, thanks. Please take the microphone.
Hi, thank you all for giving me the opportunity to speak today. I am a student in medicine and aspiring to be a physician scientist in my career. And I entered medicine with the ambition to make a difference in the lives of people, and also to go into research to do that sort of on a broader scale. And since coming to med school, I've been confronted with a few realities that seem to make that aspiration more difficult. I came to med school thinking America is, a leader in healthcare technology, and we're the brightest and the best, believing all those kinds of things, but I then found out that actually we're the only industrialized nation that doesn't offer universal health coverage. We have among the lowest lifespan of industrialized nations, and also the highest infant mortality. The Institute of Medicine estimates that lacking insurance in this country causes a 15% excess mortality. That's 18,000 deaths per year, pretty similar to the homicide rate in this country. People without health care aren't able to get prescriptions, they get later diagnosis and have advanced disease, and they can't get therapy after their diagnosis. So these are all these barriers that are preventing people like me in the future, and the doctor you just heard from giving good care to patients. I also realized that the cost of health insurance or health care, in this country is astronomical, and that we're just not getting a good value for our money. We spend 1/7 of our GDP on health care, twice per capita what Japan and the UK spend. Yet, like I said, we have low lifespan and high infant mortality, and other predictors of poor health as well. The cost of health insurance premiums has been rising at 5 times the inflation rate. So one of the big reasons in my mind that we need a more universal form of healthcare is to control those costs and make the delivery of healthcare based on good practices and equity, rather than people's ability to have insurance based on either their money or pre-existing conditions. So some benefits that I see to patients for having a single-payer system, universal coverage, are their portability, it's already been mentioned, the ability to that their health care won't be dependent on their job, provider choice, and continual coverage, which will mean better health. There's actually benefits to businesses as well. It costs a business $10,000 to cover a family of 4 through our health insurance system today. And this is just money that is out of employers' pockets that they could be paying employees in wages, and also that they could be competing better on a global scale. And there's also a tremendous benefit to having a centralized system of healthcare delivery in this country. To me, as a future researcher, we have this really fragmented system of healthcare right now, and also a really fragmented system of healthcare information collecting. So we don't really have a very good way to compare treatments and outcomes across the country. We have kind of small pockets of data that we can collect, but on a large scale, the only large-scale database for collecting data is Medicare. And so we know a little bit about the best ways to treat this population, but as a future researcher, I see this tremendous untapped pool of information that we could use to make health in this country better if we could just coordinate the care and thus coordinate the information collecting. That's about all I want to say. I do want to admit, some of you, I think, in the audience aren't completely sold on one or another plan for coverage in this country, but I want to admit a few potential cons to a single-payer healthcare system. One of them is that we would be trusting the government or a body, at least, to come up with a healthcare plan. So we wouldn't be choosing that, but we would be choosing our providers and our hospitals. We wouldn't be locked in by a profit-based insurance company. There is always the potential that the government won't be able to fund this completely in times of recession. I just talked to somebody from Belgium, and they're having this problem in their country right now. There's the potential always for mismanagement. There's just the ever-present fear of giving the government too much control and taking control away from the private sector, but the reality is that right now the system of healthcare we have in this country, the power is in the hands of a for-profit industry. It's not in our hands either. So I would argue that putting the power in the hands of elected officials is better. There is also the reality that we can't give every intervention to every person. I mentioned that the cost of healthcare in this country is astronomical, and so it's true that we won't be able to give every treatment to every person, but I say let's ration based on equity and effectiveness rather than insurance status. That's all I have to say. Oh, and I also feel like that this notion of healthcare delivery is in line with American ideals of equality and opportunity, as well as life, liberty, and the pursuit of happiness.